Back on Morning Line, thanks for joining us. Our guest is Dr. Gill Wright, Associate Medical Director for Metro Health. Has been involved with, obviously, the Nashville City's response to the coronavirus. Taking your phone calls. We're streaming live right now on Facebook at newschannel5.com. If you want to issue a comment to us, we'd love that. Or give us a call. And we've got some calls here waiting through the break, and we will go next to, I believe, Donna on 3. Donna, good morning. What's your question, Donna?
My question is, I live in Goodlettsville, Tennessee, and yesterday we heard that a prominent member of the community was infected with the coronavirus, and I think he has a very serious case. As a member of this community, what are the chances of it affecting more of the people around us since it's so close?
Well, obviously, excuse me, obviously you have to come in contact directly with the virus. So if I'm sick and my child has been with me, until they have symptoms, they're not infectious. Now, should they be staying home? Yes, but if they were on a soccer team yesterday that they practiced with, today I find out I'm sick, we keep the child home, that soccer team wasn't exposed. So you don't get it's not twofold removed that can be infected. So you have to be actively infectious to spread the illness. But we're going to see more people out in the community as time goes on that are going to be positive. It's slowly spreading, and we're trying to slow that spread. But yes, there's a chance at some point people are going to be exposed. It's unfortunately here, and I don't think it's going to go away quickly.
It's going to take some time.
It's going to take time.
It's interesting, as we were talking earlier in the show.
Excuse me.
That's all right. You got your phone on.
I thought I had it off.
That's all right. In terms of the virus really made the big news out of China. I think it was near the end of December. And if we're believing the reports out of China now, here we are in March, and it looks like that city there is now with no new cases being reported. Right. So you're talking about a 3 to 4 month period, give or take a little bit. So, we're looking, if what we're doing is going to work, and I don't like to say if, it's going to work as long as everyone's on board, then we could start looking at maybe seeing the real positive curve slowing down and maybe things slowly getting back to normal by what, maybe May or June?
Well, I would hope so, and I think we will know quicker than that how things are shaping up. I think that the initial response here in the community was through at least the end of March, first part of April. I think that'll be a good time frame to reassess where we're at. As time goes on, we'll know more every time we kind of go further along.
If it's not working, you take more restrictive measures. We know what does work, and it's the social distancing and testing and making sure the people that are sick get away from those who are healthy. Let's go to Jean. Jean, what's your question, Jean?
I don't have a question, Nick. I have a comment.
Okay.
And first of all, I want to thank you, Nick, for putting that word out, hoax. I think that there are still some people who think it's a hoax. And I don't want to put blame, but I think had the White House come out with a different forum as it related to this virus, then maybe it would have dispelled the hoax theory. So I just wanted to thank you for putting that out there and letting the people know that this is something serious. It's not a hoax. And let's just keep each one in prayer and move forward and get this over with.
Thank you for your call. Yeah, and we say that. And the White House is clearly on board. There were some early on, and we don't want to go into politics here who thought this was being manufactured, but the president himself clearly is on board on this. And so if someone out there still believes it's a hoax, well, they're just in their own little planet world, and they cannot be helped. Let's go next to Dawn, I believe. Dawn, what's on your mind, Dawn?
Hi, Nick. Good morning.
Morning.
I have a question for Dr. Gill Wright. The notion that the virus was created somehow, it was like a mutation from an animal to a human. Do we know if that is the origin? And I would also like to know if pets are vulnerable to this.
We touched on pets already, and as far as we know, the answer is no to that. I was asking him that very question, your first one, during the break. Go ahead, sir.
So coronaviruses as a group are typically what are called zoologic viruses. So they typically are in animals. They get a mutation that allows them to infect humans. And so most likely this did come from some animal.
Supposedly a market there in the Chinese
supposedly a
city.
market there,
Right.
probably contamination. One of the most common places that these come from has been bats. So, but we haven't, as I said earlier, it's a new virus. I don't know that we've really completely understand yet where it came from, but it probably came from an animal host. It had mutated such that it then could infect humans, and with that mutation, it also it was able to transfer from human to human, not just from the animal to us. So now we're spreading it between ourselves.
Yep. All right. And as far as some people concerned about pregnant women, do we notice any kind of illness when you're pregnant is obviously a concern for the child. So is there anything special about this with regard to a pregnancy?
There, obviously we're trying to keep pregnant women from having the virus.
Of course.
I have not seen any real numbers on whether or not they're at significantly increased risk. Obviously they're at risk. Anytime, as you said, anytime a woman that's pregnant gets something like this, we would be concerned.
Okay, again, it's still though, it's the unknown.
It's the unknown that's
Really
the
the
problem.
scary thing. Let's go to Derek. Hello, Derek.
Yes, sir.
Go ahead. What's your question or comment, sir?
Good morning. How you doing? My question was for Dr. Wright. Recent reports indicate that in China, a dog contracted COVID-19 from its owner. And I was wondering if there's anything we can do to prevent our pets from being infected, or, if this is a concern for agriculture or anything like that, as far as livestock and things like that.
Well, he just heard us talk about how it came from animals, but we touched on that. Again, a lot of people worried about their animals. Go ahead.
Sure. The animals, what we know now is that there was one case reported. That animal was mildly positive, and the dog never got sick. The probably tested positive or was showing up positive because the owner had it, and all the little virus particles were on the dog because they'd been coughing, sneezing on the fur.
Yep.
And so that's why it tested positive, but the animal itself never became sick.
Trust me, if that is the only case we've seen, possibly, and that
Yes.
doesn't even sound like one, by now, don't you think we would be seeing more animals getting sick from this if it was something that went that way?
Yes, absolutely.
Yeah.
And we have no indication of any travel from humans back into animals at this point.
And we're not just talking about dogs. We're
Right,
talking
not
about
just about
cats, or
dogs.
he was talking about horses or cows. No
Right.
evidence of that.
Right.
Fair question, though. I know a lot of people wonder that, but we want to make sure to get that out so you don't worry too much about your cat or your dog. And let's go to Christy. Christy, good morning. Hi, Christy.
Yes, good morning.
Good morning. What's your comment or question?
Yeah, hi. I actually had a follow-up question concerning the virus and how long it stays active on surfaces. The doctors seem to kind of poo-poo that off. That seems to be a little contradictory towards a study that was released by the NIH a couple of days ago that's showing that the virus is still active on cardboard after 24 hours. Can we talk some about what people need to do as far as actively killing virus on surfaces, the 95% alcohol recommendation, those types of things? Can you expand on that a little bit and why the information you gave earlier was contradictory towards this new study?
Right. So the virus can live at least 24 hours, although it has to have a pretty specific environment to do that. And we're not sure that that's all surfaces. Yes, if you have a concern that somebody's been sick, coughed, sneezed, that type of thing on any hard surface, I would definitely wipe it down. I would definitely be using a good disinfectant. The government has certified a number of the disinfectants to be able to be active against coronaviruses.
Yeah.
So I would use one of those. We're using a phone here in the studio. I would wipe that down. If somebody else was using it before I was that I thought was sick.
Yeah.
So that I didn't transfer.
I can tell you that's exactly, before you came in, this whole desk was wiped down, this was wiped down, my desk is wiped down, and so I think Christy's point is well taken. A part of it is we try to know what we know, and you're right, and under perfect conditions it may live for 24 hours on cardboard or other surfaces. There's still so much unknown. So, from Christy's point, I think, is better safe than sorry. And I'm wiping everything down. Even what did the Dr. Fauci say? You know, with the CDC, it's like if it seems a little extreme, you're probably right on the mark, right?
Right.
If you want to go overboard, and make sure you wipe everything down, nothing wrong with that.
And if you touch something that you think might have the virus, so if I picked up your phone like we talked about earlier, if I put that back down, I avoid touching my face, I immediately go wash my hands, then that's good because I'm going to get that virus particles off there. So touching something like we talked about on the store shelf, yes, there may be a few viruses. I just want to avoid, touching my face to transfer that until I can get my hands washed or wiped off with if I don't have soap and water, Purell, or one of those other disinfectants.
What I continue to be impressed by and gratified by, because they're kind of like me, I'm concerned, maybe on occasion a little bit frightened by it, but our callers and the folks on Facebook, so rational and thoughtful, maybe don't agree on everything, but that there hasn't been a panic. And because of officials like you and leadership from Washington, D.C. and here as well, just so we're clear for folks, in the coming days we are going to see more cases. Primarily because there's more testing, so we can find these cases that were already there.
Right.
Don't panic on that. Don't freak. Just recognize that that is part of the process. I want to remind folks like that, and you guys will be the first to tell us when we start seeing that curve decline, which may be a few weeks out.
Right. Yes, we'll be, as we've been doing, updating our numbers on a daily basis, having press conferences as needed and such, so yes.
Well, and we will be covering the news conference. The mayor here in Metro will be having one again at 9:30. It'll be live here on the Plus, so we'll have that for you, and continue to follow this. Look, Doctor, I really appreciate you coming on. I wish we had more time. We have so many calls and questions coming in, but the main thing is there's all kinds of outlets to get this information.
Absolutely.
Okay, and watch these news conferences, and we'll do more on this program as well. But thank you, sir. Once again, it's a break with tradition for me. I always shake hands and thank. We don't do that right now, do we? So you please take care of yourself. Thanks for coming on.
Thank you.
We'll take a break,
Appreciate it.
and I'll be back with a programming note for you right after this.